Hey, I'm your host, Dr. Desiree Cassell. I'm an orthopedic and pelvic floor physical therapist specializing in women's health, aka pelvic floor. I'm a wife, mom of 3, foodie, lover of all things movement and nature, and I'm super passionate about educating, empowering, and supporting other women like you to find and maintain balance throughout all aspects of their lives, without pain, pressure, or peeing their pants. And this is the Balanced Momtality Podcast, where we will talk about all things pelvic floor, your core, and optimizing your pregnancy, birth, and postpartum recovery, providing you with the knowledge and tools so that you can feel like the strong, playful, and happy mom that you and your family deserve. Now let's get you out of those pads and back to loving movement. Fill up your water, pop in those AirPods, roll out your mat, and let's connect. Before we start today's episode, just a quick disclaimer that anything mentioned in this podcast is not meant to treat or diagnose any medical conditions. If you have any questions or concerns about your healthcare needs, please seek the care of your medical provider. This is also a safe space where we will be talking about very sensitive but important topics, such as issues with peeing and pooping, relationships, and even sex. So if you have littles around, probably a good idea to pop those AirPods in. But otherwise, I hope you enjoyed today's episode. Hey friends, so glad you're joining me this week on the Balanced Momtality Podcast. How are you? It is that time of year. Life is a little hectic, at least I know it is for me. Last week on the podcast, I released my episode with a special guest, Ashley Fillmore. She is a women's health coach, and we chatted about mindset because, it's that time of year where we start to fall off or get overwhelmed and stressed, and our own health and routines start to get pushed to the back burner. So if you didn't listen to that episode, go check it out because it is just a great reminder that it doesn't have to be all or nothing. If you are finding that your routine that was working for you isn't anymore, that doesn't mean we stop all the things. It means we might need to reevaluate, and maybe your mental health and your mindset are a big player in that. I named my practice and the podcast The Balanced Momtality for a reason. It obviously stems from mentality because that mindset piece is crucial. You have to be in the right frame of mind to make the right decisions and to feel good about it and not feel guilty or like you're pushing yourself into doing things that you don't really want to do just because you think you should do them. We really want to get your mindset in a healthy place and help build a sustainable routine that you can show up for consistently. So if you feel like you are having trouble right now, go listen to that episode and also reach out, whether you just need support or to vent or you need to ask questions and just make sure you're not doing something wrong. Come over to the Balanced Momtality Wellness and Support. It is a free and private Facebook group where I am there answering questions. It is very quiet. I am usually the main one posting on there, and I do have a lot of people that comment, but I would love for you guys to just show up there and post yourself, ask questions, tell me what you're working on. I am there to keep you accountable. So even if the group is quiet, hey, that's more attention for you. So take advantage and go over there and let me know what you think or what you're having troubles with. But this episode, I did just want to give you guys a little life update. This is also going to be a pelvic venous disorder update because, yes, if you are following my journey, I have been struggling with pelvic venous disorder for a few years, but it wasn't until it's been about almost exactly a year that I found out that I actually had it. And so this last year, I have had 3 procedures now. In March, I had my first pelvic vein embolization. And again, you can go back into the podcast vault. There are episodes back in March when I just found out about this diagnosis, what I learned about it, what I'm doing about it, how that procedure went. I've had a few updates on the podcast throughout. So just screen, it will say PeVD or update on my journey in the title, and you can feel free to catch up and follow along on my health journey if you're at all interested. But for those that are and that have been checking in, I'm just so grateful to you. It really has been supportive and helpful for me because mindset for me lately has been been a struggle because this has been a really humbling experience. I'll tell you that much. Being a practitioner that's trained on treating all of these things from back pain to hip pain to pelvic pain and heaviness and prolapse and leaking and right, like all of these things that I know how to treat, at least to some extent, because I was feeling like a failure with my own condition, having this cramping and pelvic heaviness that I couldn't get to go away with breath work and soft tissue release, no matter how much I used my wand and tried to relax my pelvic floor. And I was just still having pain. And the imaging found that the really valid reason, right? My veins are so stretched out from pregnancies, but we also found I had a compression, which is May-Thurner syndrome for the vein that I had compressed. So my iliac vein on my left side of my body had been being compressed by my right iliac artery, just the way my anatomy has been. And I think because of that, and then having 3 kids, which drastically increases your blood flow, it caused a backup. So I got what they called pelvic congestion, but it is newly coined pelvic venous disorder. And it has been a journey. I'll just do a brief synopsis because initially I didn't have any of the typical symptoms, signs and symptoms of pain with standing, pain with sitting, pain with exercise, pain with sex, right? Like anything that causes either an excessive increase in blood flow or a stagnant blood flow is where you would get pain. I didn't have any of that. I really just had ovarian pain. I had really sharp ovarian pain. I thought I had a cyst, but I think I just caught it early enough because as I was getting up to my first embolization, I started having a lot more pain and I started having pain with exercise, and it was really stressful because exercise is how I de-stress. That is my mental health piece as well. And so it was a struggle once that started to get painful. And the embolization I got in March really did help. I know it was a lot rougher recovery. Again, go back over and listen to that episode if you want all the deets. But it was a rougher recovery. I had 30 metal coils put in around my gonadal veins to block up the blood flow that my body had created to offset the pressure in that space. And so my body reacted to those coils, and I had post-embolization syndrome, which was super uncomfortable. And I felt really inflamed and achy for a good 4 to 6 weeks. And once that 6-week mark hit though, I started to finally feel lightness in my body that I didn't even know existed. I had forgotten what it should feel like in my abdomen. After having that weight removed, it was so drastically obvious how much pressure was waiting on my pelvis. And it was so nice to not have any of that. I didn't have the cyst pain. I did have a low-level cyst pain right around ovulation and the first day of my cycle, but it was super low. It was lower than it was previously, and I wasn't getting it any other time of the month, which I was starting to have that pain regardless of the time of my cycle, but it was a lot worse during ovulation. Ovulation comes with a lot of blood flow, a lot more estrogen brings in that blood flow, and it was just super uncomfortable. And so I had a good 3 or 4 months where I felt amazing. And it was really eye-opening to me that even though we're trained in pelvic floor PT, that pelvic veins and just vein issues in general don't cause pain, it's bullshit. I can tell you firsthand. Having my veins worked on was the first thing to really take a lot of that pain away. And it was a humbling experience because, I can't treat and fix all the things. But again, there are a lot of things that the pelvic venous disorder caused that I could treat, and I did. And I think that's what kept me from being more of a stereotypical pelvic venous disorder person where I didn't have all that pain because I was working on optimizing my circulation and taking pressure and weight off of my pelvic floor. And I was working on all of the things that were going to add to my pain and make things worse. But unfortunately, within the last few months, right around August and September, I just started noticing the pain creeping in again. And I started noticing it wasn't just during ovulation and my menstrual cycle. I started waking up with it, started getting really uncomfortable. I started getting pain with exercise, and it just became a big pain in my butt. So I decided to have another pelvic vein procedure back in November, and I did do my most recent update was right before that procedure. So this is a full update on what has happened since then. So this is kind of crazy stories here, guys. I went in to get this pelvic vein procedure done, and it was an experience, that's for sure. It's conscious sedation, so you're awake for all of it. You're just kind of groggy, and you feel kind of out of it. But I was still awake, listening and hearing everything that my surgeon was telling the people in the room, because he was kind of teaching them as he was doing my procedure. And so he's going through, and he's talking, and he's like, well, let's go see how this right side's doing. And so he was doing his procedure was where he was going in with contrast and pumping contrast to see where the blood flow goes, and then going in with a balloon catheter to block off blood flow and see how that handles being treated. And so he was making sure that he only treated what needed to be. And he, at this point, all I can really feel is the tugging and pulling at my neck, because they do go in through my jugular vein in my neck, all the way down into my pelvis, because it's just a less windy route than going up through my leg. Not fun, because I have to sit there with my head turned to the left side for 2 hours while they tug and pull on my neck, and I hear the threading in and out of the catheter. But overall, I did feel a little bit of like nervy pulling and pressure and poking down in my pelvis and around my butt, which was interesting, but it wasn't terrible. But I hear him telling the guy in the room that, yeah, so you really don't want to have a compression here, because if you do, this spot pretty much guarantees low back pain if you get a stent placed. And so now we're not really doing that. Now you have to actually do a more open procedure and just transect that vessel and move it. And I'm there on the bed thinking, oh my God. And thankfully at the same time he's saying, but thankfully she doesn't have an issue with this vessel. Like, oh, thank God. Okay, I don't have that. Good. But he's like, let's see the rest of the right side. And so he's working on the right side and flushing contrast. And he's like, oh man, yeah, there's quite a bit of varices over here. So those varicose veins were really congested on my right side. And so he treated them. And for this time, he actually, because I guess the iliac vein has a slighter increased chance, a 2% increased chance, which changes it from 2 to 4% increased chance of coil migration versus the gonadal veins I had treated previously. So because of that slightly increased risk, the surgeons are opting for more sclerotherapy in these veins. And so we didn't do coils, and he did the sclerotherapy in my veins in November. So he does the right side, works on them, and then he goes over to the left, and he's like, let's see what's going on over here. And he's like, well, actually, there's not that many varicose veins, but look, there's all these collateral veins that her body created. So my body created these vessels from my left iliac that went through my uterine muscle all the way to my left iliac. So my body created all these crazy veins to try and shunt blood flow and pressure. And so he's like, well, let's see what happens if we close those up. So he put the balloon in them and he closes them up and he goes, oh, shoot. Well, see how all the blood's going back down her leg? Like, yay. And so he said, so this is caused because of another compression you can have on the iliac vein, which is May-Thurner syndrome. And the compression on the other vein is called nutcracker syndrome. And thankfully I didn't have that one, but I do have May-Thurner syndrome. Again, my right iliac artery is compressing my left iliac vein just with how they sit on each other. And so within that procedure in November, he was able to determine that, in fact, he will need to work on my stent at some point soon, which was a big bummer because ultimately I was really wanting to avoid a stent placement. It is a little bit more intense of a procedure, but it was also reassuring and validating because he was very confident that, one, it needed to be treated, but it was probably the root cause of why everything got backed up. And seeing the imaging, I mean, it's wild. It's pretty crazy. If you want to see it, go over to my Instagram the Balanced Momtality in my PeVD stories highlights. I have the most recent imaging because it is really kind of crazy, and I'm always so fascinated by it, but it was really validating because it did show that, in fact, yes, all of the blood flow is getting pushed over to the right side of my body in this crazy swirly map of veins, and then, ultimately leading to me needing to get this stent placed. And so my recovery after that embolization or vein procedure in November was actually really not that bad. And I think it was because I didn't get those metal coils placed, so my body didn't have that crazy reaction, because I didn't have any of those flu-like body aches or fever or a lot of pain. It was just a little bit of soreness. My neck was a little sore. My pelvis was a little achy that first week, but nothing crazy. I did have little moments of pain and pressure, and I did start to feel pressure going down my left leg. And, it just made me kind of glad that I was getting a stent placement soon, because after clogging up everywhere that the blood wanted to go, now it didn't have those outlets. So I was worried that it was going to cause more issues. But my doctor got me in pretty quick, and I had my pelvic vein procedure in November on the 14th, and then I got in on December 5th for my iliac stent placement. So just almost a week and a half out now from the time of recording this podcast. And yes, I have to say it was a big difference. So I had a lot of pain on and off, not high intensity, but it was starting to creep in as I was getting close to the stent placement. So part of me was ready. I was ready to get this done. And it was kind of nice. They were going through my femoral artery, so no more vein, so no more going through my neck or anything like that. So I could just lay there normally. However, it was kind of nuts, because even though I'm pretty numbed out, right? Like, you're kind of lethargic and you shouldn't really feel much, because I had all these pain meds coursing through me. I was lying on that table and he was putting the catheter in to put the stent through, and it felt like a moment of like a popping pressure almost. And it wasn't it was kind of sharp, right? Like, it was enough pressure that I was tearing. I had tears coming out of my eyes while I was getting that stent placed. And I'm just being honest here. I don't want to scare you guys. It's not like I'm being like, it was so painful or don't do it, but it wasn't painless. That's for sure. And it was kind of crazy, because it even kind of sounded like a little pop. And he said, that's how compressed your vein was. I just had to push through that compression. It did not want to go through. So my body was really, honestly, doing such a great job of shunting all my blood if it was that closed off. I'm so surprised I wasn't having like severe left leg swelling and pain with how much blood flow wasn't going up into that vein. My body was basically shunting all of my left side of my blood over to the right and making my right side pump it all up to my heart. And so no wonder I've been having all of this pain, especially on my right side. And you'll see if you go to my Instagram story highlights that it is night and day. The before and after imaging is crazy, because you do see that blood flow swirling and twirling all over the place from left to right. And then after that stent's placed, it goes just straight up, just like it should. And so super reassuring. My surgeon was really happy with the outcome, and overall, I can't wait to see how this really affects my vessels, my pain, my overall health, my constipation and hemorrhoids. Like, I am now convinced that most of those hemorrhoid issues are from all of the backup of this blood flow. Like, obviously that blood had to go somewhere, and it decided to go from my booty. So that was fun. But the other unfortunate part of this, well, there's a couple things. So the one thing I was not expecting, so going into this procedure, having them go through my femoral vein, I thought, well, the recovery might be a little crappier because they're going through my leg, so that might actually hurt to walk. Like, just lifting my leg and moving is probably going to be a little bit harder. It didn't really hurt at all. My leg was not the issue. Actually, it was my back pain. So even while after they placed that stent, and then while I was in recovery for 2 hours laying there, I had the worst back pain. It was so uncomfortable. And of course, I can't move, right? Like my leg has to stay straight. And that means I can't put pillows under my legs to open up my back. I can't bend my legs. I can't roll to my side. I just had to lay flat. And my back was killing me. And when I was leaving, the doctor was like, well, that's where the vein refers. So it could be anywhere from a few days to a few weeks until that heals. You might have a little bit of back pain. I'm like, awesome. And they did. They sent me with oxys. They told me to alternate Tylenol and ibuprofen. Like it was going to be a lot of pain and discomfort. But I'm not a fan of oxys, so I did not take those. I did alternate with Tylenol and ibuprofen for a day or two, but then I even ultimately got off that and was just using cannabis for pain. And sleep, because that was the other big issue. Was sleep was so hard. This has been such a humbling experience. I feel so much for my patients that have chronic low back pain or chronic pain in general, because even my last update, I mentioned that chronic pain sucks. Starting to have that lower level cramp ache for days and months just was getting so taxing, even mentally. But having that intense, severe pain, even though it really only lasted about a week, thank God, because otherwise I don't even think I'd be able to be at work. But even that week was just miserable. The pain was so intense. I felt like I could barely move without just getting this jolting pain. Anything that increased my intra-abdominal pressure. So I couldn't even take deep breaths. I was trying so hard to be good and do deep breathing, especially since I had to lay on my butt. But it just got so uncomfortable that I really couldn't do it very well for the first couple days. And my back was just so locked up. Well, it felt locked up. So I was even on my foam roller. I was doing stretches and I just couldn't touch the pain. And that really just goes to show you the cause of the pain, right? Like, and I know this, knowing how muscle pain reacts, you should be able to find it, right? Like put your finger on it. Ow, that hurts. But no matter what I did, I could not find the spot that recreated that pain. And it was because it wasn't coming from my muscles. It was coming from the vein internally. That vein was inflamed and swollen. And whenever it got pressurized enough to touch other tissues or touch my peritoneal cavity, that's when I was getting pain. And that space does refer to that left flank. And so the interesting thing is I started to realize that, whenever I quote unquote flare or tweak my back at all, I usually attribute it to like, oh, I did something weird at the gym or I slept weird or whatever. And it's very random and it's not that often, but I do have bouts of low back pain here and there. And it is always my left side. And it is always that left flank, and it feels almost the same as it did with this recovery, just not as intense. So it was really insightful for me because I'm pretty sure the pain that I would feel in the past was coming from this vein the whole time, which is also really nice because if this gets solved, my back pain will also go away. So that's exciting, but it has been a bummer to have so much back pain, and just having to move around that much or that way is so uncomfortable. And so, man, if you're someone who struggles with chronic pain, I feel you and I am so sorry. And there is a lot we can do, and movement does help, but it's hard when you know how you're supposed to rehab yourself, but then being the patient on the other side in pain and not wanting to move, but telling yourself a little bit is good, but then it hurts when you move. It is a mind fuck. Like I've been struggling with myself. I just want to lay there. I get home. I'm starting to get crampy halfway through the day. And again, I'm only a week and a half out. So this is all normal healing, but I am still getting crampy throughout the day here and there. And so I go home and I lay down and I put my butt in the air and I'm elevating and I'm doing all this stuff. And that's all that feels good. And that's all I want to do. But then I'm starting to get like neck pain and shoulder pain and my SI joints starting to act up a little bit because I'm just sitting on my ass all day. So I know better and I am trying to get little bits of movement in, but be patient with yourself. Give yourself time. We always need someone else giving us advice. And I did need my surgeon last week to tell me, no one needs to be a superhero, Desiree. You do not need to push it. You are a week out from surgery. You need to rest. So if you are new out from a surgery or you have an acute flare of pain or you are just struggling with pain, just know that you're doing the best you can and don't push it. You definitely need to rest and heal. But if you have spent days on the couch like me, it would be good to also get some gentle mobility in. And I can tell you, the other morning when I did finally go through a nice rhythm and routine of some gentle stretching and gentle core stability stuff, my pain was better. But it was still there, right? Because my muscles can't affect how swollen that vein is. So it is just going to take time. But I am really hopeful that this is going to be my last procedure, fingers crossed, and that all of my vessels and circulation is now in an optimal place where I can get back to exercise. And honestly, I'm really excited. That is one of the pluses, is that because we didn't use coils in November, and because this stent is a 3-inch, so I have a nice 3-inch piece of titanium nickel in my iliac vein, it's not going to go anywhere probably. And so my surgeon actually said that I could probably start getting back into the gym in a gentle way in the new year, which I'm so excited about, because I thought that with this procedure being pushed into December, that I wouldn't be getting back till early February. So that is hopeful for me. I am looking forward to getting back in the gym. I miss my lady friends at the gym and I miss moving my body, but overall I am recovering, and I just wanted to give you guys an update because yes, I've not only had 1 but 2 procedures since my last update, and hopefully that is all. I did forget another unfortunate thing with this one. Because it is a stent placement, they obviously do not want blood clots. So it's the opposite of the coils, right? When you get an embolization, they put coils in that varicose vein, and then they depend on your body's clotting response to clog that vein up so that it just doesn't work anymore and it gets literally clogged up so nothing goes in there. But with this, they just placed a huge metal stent, and they don't want it to get clogged up. Obviously, they placed it to open it. So now I'm on blood thinners, which I didn't think was that huge of a deal. I do have to stay on them for 6 months, which isn't great, but whatever, I can take a pill. However, this first month, I have to take Lovenox, which is not a pill. It is an injection. So I am actually having to give myself a blood thinner injection twice a week into my stomach for 30 days. So yes, 60 times I have to stab myself. It is not very fun. I'm a week and a half in, slowly but surely, one day at a time. Again, so humbling. I feel for you guys so much who have done IVF or insulin, especially if it's lifetime. Like, you guys, you're rock stars, because it is mentally so hard to stab yourself with a needle. Obviously, it gets a little easier, but it's still not fun. And it's not even so much the stab as much as it is the burn that the meds have. It feels like a bee sting, and it lasts for like 10, 15 minutes. And so, yeah, it's pretty uncomfortable. Very not fun. A part I was not anticipating. And that's probably been the most uncomfortable part of all of this since my back pain has calmed down a lot. But yeah, it's a journey, man. And we are all just doing the best we can. And it is the holidays. It is chaos time. I know I am definitely trying to balance all the things right now, and mental health being a big one of them. I hate to say I've been feeling tapped out with my work, with trying to keep up with all of it, with my procedures and recovery, and then pain nagging in the background, where I haven't been my best self, especially with my kids lately. And I am just really trying to mentally prep my mind and my body so that I can get in a better place to feel motivated to exercise, to show up better for my kids, to be able to go back into the gym confidently and not worrying that I'm going back too soon. And also trying to talk myself into the fact that it's going to be very gentle and I'm not going to go back too intensely. And I'm going to need a game plan. And so one of the things I am teasing on this podcast episode is that I am releasing a app in the new year, hopefully in January or February. So stay tuned. My app is going to be Pelvic Floor Core and More. I am teasing it here because I want my patients and my listeners to be the first ones to jump on this deal if they want to, because I am going to need beta testers, and my beta testers will be running through the whole app program with me week by week. And it is like an online course at the accessibility in your hand with weekly exercises and instructional lessons so that you feel like you have a pelvic PT in your pocket. There will be a community on there so you have access to me in a private and secure way. And you guys are going to help me build it out, you beta testers. And so you guys will get a huge discount on this service. And so I'm only taking about 10 to 15 people in my beta launch. And so if you are interested, send me an email or a DM or go over onto my Facebook group and just let me know so that you can be first on the list, because I am not letting everybody into the beta launch. But I really need people who are wanting a great deal on getting a program that is going to help keep you accountable. It's going to be safe and effective for you, and you're going to have the guidance and support of a doctor of physical therapy right there at your fingertips for a huge discounted price. I need you to be motivated to follow through with these exercises and have the time for about 15 to 30 minutes a day. And initially it might be 5 to 15, but I'm definitely building that out. So we have longer workout videos for those that want to do longer exercise routines. And then I will be getting feedback from all of you so that you guys can help make this the most resourceful women's health and especially pelvic floor app that you would like. So if there are features you want to have in an app like that, or topics you would love to get discussed, or courses or things you want to track, let me know, because again, I am building this out right now and the feedback I get from you is going to help make this the best it can be for you. So again, if you are interested in that beta tester spot, please let me know and keep an eye out, because I'm going to keep putting this plug out, especially because I haven't hard launched my beta program yet, but I'm just putting a teaser out there. So for any of you guys who do want to jump on right now, let me know. But otherwise, stay tuned, because I have a lot of great things coming for you in the new year. Also, just know, since the holidays are coming up, my next few episodes are going to be replays of the best of the Balanced Momtality podcast. So I hope you enjoy some of the old classic favorite episodes. They might be a good refresher for you, or if you're new to the show, you can get a taste of some of my listeners' favorites. But otherwise, I hope you guys have a wonderful holiday season. Merry Christmas. Happy New Year, and let's make sure we are following through this winter break and starting the new year strong. And that is where my app is going to come into play. So if you're wanting some accountability and support and some guidance to get on a good rhythm for 2025, that is the place to go. So I'm so stoked and looking forward to it, and I can't wait for you guys to see it. Have a Merry Christmas. Well, that's it for today's episode. I hope you enjoyed it as much as I did, and I want to thank you so much for taking the time out of your busy day. I know you've got so many other important things going on, but I hope it was helpful and you leave here with some tools to help you in your healing journey. And I just want to ask you, if you have found this helpful, to please leave a review on iTunes. Scroll down to the bottom of my podcast page and leave that 5-star review so it can help other women see this information. And also, if you want to be a part of my community of amazing women trying to balance all the things, great tips and insight and sharing stories and just motivating each other along the way, feel free to join my Facebook group, The Balanced Momtality Wellness and Support. I hope to see you here next time on the Balanced Momtality Podcast.